Why is everything falling apart down there after menopause? What are some changes that happen to the pelvic floor after menopause? These are some questions my patients ask me all the time in the office, so let's talk about it. Hello everyone, this is Dr. Nabila Noor, a board certified and fellowship trained urogynecologist and pelvic reconstructive surgeon, and today we're going to be talking about what happens to our pelvic floor after menopause. So what is menopause, first of all? So menopause for most women can be around the age of 50. The average age of menopause is 51, but for some women it can be a lot earlier than that. For some women it could be a little bit later than that. So our ovaries stop producing the hormone called estrogen, and as a result of this, our body goes through some anatomical changes and physiological changes. Specifically in the pelvic area, anatomically, we do notice some thinning of the labia, of the vaginal tissue, of the bladder wall, and the urethral wall. Remember, the bladder is the organ that stores urine, and urethra is the pipe through which urine comes out. We also notice lack of rugae in the vagina, which is basically the folds of the vaginal tissue. So prior to menopause, the vagina has a lot of folds, which allows it to stretch, which, as you can imagine, enables women to have childbirth and also can help with intercourse. But once women go through menopause and they have a decrease in estrogen, that rugae, that elasticity is lost. So physiologically, these can cause symptoms such as vaginal pain, vaginal irritation, burning, discomfort or pain with intercourse, lack of lubrication. Women can also have urinary urgency, frequency. They can develop recurrent urinary tract infections. So a whole host of symptoms. So together, these symptoms are often known as genitourinary symptoms of menopause. It's a very complicated name to essentially describe the changes and the whole constellation of symptoms that women can develop as a result of menopause. So the big question is, how do you treat that? Believe it or not, this treatment is so simple. Starting patients on some vaginal estrogen cream. Yes, you heard it. Starting patients on some vaginal estrogen cream. When I tell my patients first about this, that here, let's start you on some vaginal estrogen cream and this will solve all these problems, they look at me like, wait, what? That's it? Yes, that really is it. The problem is women have been so scared about using estrogen cream for so long, and just estrogen in general, because they've been told that it can cause blood clots, it can cause breast cancer, and while that may be true for some patients, it's not for everyone. But the thing that I also tell my patients is that vaginal estrogen cream is very different than taking an oral pill. So when you use the cream locally, the amount that gets absorbed in your blood is so low that it doesn't have the same side effects as taking an oral pill. But it can work in the local tissue, which is what we want, because that's what can help with improving the dryness, the pain, the irritation, the urethral and bladder problems. So if you are somebody who's suffering with these conditions, then please talk to your primary care doctor or your OBGYN. And if they're not comfortable with starting you on some vaginal estrogen cream, have them refer you to a urogynecologist so we can discuss these symptoms and get you started on some much needed vaginal estrogen cream. Believe me, this is a game changer. I see patients like this every day in my office. They're so miserable before and a few months of estrogen cream and they're a completely new person. So if you found this video helpful, please subscribe to the channel, share it with those who you think might benefit from it, and I hope to see you soon. Thank you for watching. Bye.